So thanks so much for joining. We're really excited to be sharing and have officially launched our Community Voice Survey. So this survey is really a direct response from our partners from the last needs assessment to include more direct community input in our needs assessment and our prioritization process. As you've probably heard, if you've been in our committee meetings or keeping up with the newsletter, we're about to start, and well, we have started now, our latest needs assessment. It's already been 3 years. We're gearing up for that 2019 kind of official plan. So we're really excited to be ahead of the game, really working to incorporate data from multiple sources to make this a really successful process. The Community Voice Survey is kind of one of 3 data streams that are coming together to help us better understand the needs of our community and the needs of our partners. So the first stream is really talking about the existing data that we have. So a big headline for this needs assessment is we're not starting from scratch. So if you're part of an existing work group or committee, that work is going to continue. We're hoping to build on it and expand on it, find out what's working, what's not working, and really move forward together. So we have a lot of information about partner engagement and the needs of our partners that we've heard along the way. We also have, obviously, our website, njhealthmatters.org, which you'll see a little bit of in the preview today. That website, in addition to being the place where you can go see a preview of the Community Voice Survey, it's also where we have about 150 different health indicators that we're tracking that are helping to inform this process as well. So if that's something that you're interested in and learning more about, you can visit our website, and you can also see in the same place where the preview is, a webinar from previous days on how to best use the website and the data that's there. And then the final stream of data that's coming together for our prioritization process for our needs assessment is this Community Voice Survey. So the Community Voice Survey, which I'll be going through today, is really a labor of love of the data committee of the collaborative. So that includes some folks who are on the call today, but a lot of partners, kind of all the data folks from multiple organizations across northern New Jersey. And we're really appreciative to everyone who played a role in this. We also reached out to a lot of different partners, brought these up at our meetings. And so what we're showing you today is really the effort of many, many, many months of planning, discussion, and kind of thoughtful, instrument development. So we're really excited to have this. So the Community Voice Survey is based on the County Health Rankings and Roadmaps model for what works for health. You might be familiar with this. You can also visit them on the web. But you see this model here on the slide that's showing us the different factors that contribute to health. And these are all the factors that we can intervene, points of intervention that can help improve health in communities. So we wanted to model our survey on this so that we're kind of inclusive of these different factors that are good points for intervention so that we can learn more about them. So these things are the ones you see in these kind of darker blue boxes here. So the physical environment, social and economic factors, clinical care, and health behaviors. And then to the right of each of these in the lighter blue boxes, you can see the different things that contribute to that percentage. So for example, under health behaviors, you see tobacco use, diet and exercise, alcohol and drug use, sexual activity, etc. And you see this for each of these different categories. And so that's what gave us the framework to kind of hang our hats on for creating this instrument. We also looked at a bunch of other instruments to see kind of what has been used, what's out there, what's been successful, are there any good questions that we can include. And that's how we really came up with this new instrument. And it's unique to us, and it's going to be the first, but hopefully not the last time that we implement this survey. So we really want it to be something that we can track over time. Another purpose of the questions that we asked were to make sure we're filling gaps in the data that we have. So for example, if you're familiar with our website, you know that we have really great indicators on specific health outcomes. For example, we can tell you the rate of diabetes monitoring in the Medicaid population, or in the Medicare population, but we can't tell you, how many people feel safe in their community, how many people feel that they have access to healthy foods. So this is really to get at those perceptions and that direct input from community members and fill some of the gaps that we have in our data so that we're telling hopefully a more complete story. So without further ado, I want to show you what the survey looks like and where you can find a preview of it. Because really the goal of today is to help train our partners, all of you, into how to best administer this survey and get the data that is quality for your organization and for the North Jersey Health Collaborative as a whole. So the way we're administering the survey is through our partners. We're going to work to have kind of a general link for the collaborative as well, but when we were piloting this survey in some of our communities and talking to community members who were taking it, what we heard was people are more likely to take it if it's from someone that they already know and trust. So instead of necessarily, getting it from the North Jersey Health Collaborative, if you're getting it from your local Y, if you're getting it from your local church, if you're getting it from a social service organization that you already go to and participate with, you're more likely to take it. And so what we really wanted to do was to make sure that folks are getting this from those trusted sources, which is all of you and your organizations. So I really appreciate everyone who signed up already to administer and those who are kind of just deciding if they want for being here today and getting some more information about it. There's a way to sign up that I'll send out a chat link right now where you can go if you want to sign up, and that'll come up in your chat. You can go to that site and sign up right now if you want, if you haven't already, to participate as an organization distributing the survey. There's also a paper sign-up form available or a PDF version if that link doesn't work for you. So let us know before the end of the call if you want to sign up and what would be the best way to do it. So now what I'm going to do is show you where to find a preview of the survey that I'm going to show. And this is if you want to show others from your organization. This is not the way you would take the survey. This is just a preview of what it looks like, and we're going to go through that today. So on our website, njhealthmatters.org, if you go to our committees and go to Data Committee, it'll take you to this page. This is the page where we save our tools and resources, our trainings, all of that good information. So what you'll see here is the 2018 Community Voice Survey Preview. You can click, and it'll open it up for you to see. I'm going to see if I can zoom this in a little bit. There we go. Okay. So what I'm going to do right now is just go through the instrument, what it looks like. This is a preview of the paper version. So one of the things you'll first notice is that on the paper version, it's customized to the organization that's administering it. We also have every organization who signs up also gets a personalized online link. So one of the good things about the survey is it's set up to be administered in paper, in person. It can be done on your phone, a tablet, your computer. It can be administered, one-on-one if there's a need to do that, or in a group setting. And I'll talk a little bit about that more as we go through. But what we're going to do through right now is just a preview of what this instrument looks like. And just as a caveat, this is kind of the final version. I know there's obviously, points for improvement, new ideas. And as I mentioned in the beginning, we hope to administer this survey more than once. We want this to help give us some longitudinal data so we can track these things over time in our community. So if you do have ideas on improvements or additions, we're happy to take that, but please know it wouldn't be in this iteration of it. And that's not meant to be exclusive. There's a lot of people involved in planning this. It's just now it's out there and we got to be consistent for our data collection. So what you'll see here is in the introduction is these places where it says organization name. So for those organizations who sign up, the name of your organization will go here. So that's kind of what we want to put front and center. And you'll notice too, as I go through, that the survey itself kind of reads like a script, and that's intentional. So we heard from some partners that they're going to need or want to administer this with the people that they work with. So they want to specifically go through it verbally for those that might have limited language or literacy skills. So you can read through it kind of as it were a script. And so as it goes through, you'll kind of see those different prompts. And it hopefully also gives the people that are taking it on their own a little context into why we're asking these questions and to give it a little bit of a flow. So in the introduction, you'll see that organization name. You'll see a little bit about the North Jersey Health Collaborative, why we're doing this, a link to the website, and then really just a call to say we want to hear from the people who live and work in our communities to make sure that we're working in the areas that really matter. So that's one of those benefits for participation. But the other benefit for participation is we do have some incentives for folks to take the survey. So in each of our 5 North Jersey Health Collaborative counties, we have 3 $100 gift prizes, gift checks, that will be raffled off to folks who participate in the survey. And then we also have a Jets football that will be raffled off. I'll save jokes for that since everyone else is on mute. No one's going to laugh anyway. depending on the people's value of that, it could be up to $250 or more or less if you're not a Jets fan or if you are. But that's something we have to give as a prize. So hopefully someone will be motivated by either of those things. And then we ask people for their consent. And the next section is the demographics. So really talking about, we want to know this information and make sure that we talk to a wide variety of people, that it won't be used to identify you. I know that folks can be a little bit uncomfortable with demographics, but we're hoping, since it's really focused on where they live more, and you'll see that in the questions, that they'll be comfortable answering some of these questions. The where do you live is probably one of the more important questions on the survey. So we want to be able to look at this data in many ways, but one of the most important ways for us is to look at this geographically. So we've had a lot of requests from our partners for local data. So this desire to look at the zip code level to see these differences in health. And that's something we really want to provide through this survey. So we want to make sure as much as possible that people are telling us where it is they live. On the online version, this is a drop down. So you'll select your county, and then it pre-populates the next section where it says town municipality. It'll have the municipality name and the zip code together on the online form, pre-populated, so you'll only see the ones for your county, for example, instead of the whole state. And then we also know that some folks have a specific neighborhood or area that they really identify with strongly that they live in, and they can use that part as a write-in for both the online and paper version. Then some basic demographics. Really the focus here was to pick those demographic information that we think will give us the most kind of analytic power. So basically things that we know are to be related to some of the other factors in the survey that we might be able to do some, to look more deeply in to see how people's responses vary by these demographic characteristics. So things like education, household financial situation, health insurance, and then a question of caregiving, because we have a lot of interest in some of our groups working specifically on caregivers. So we don't have a good number for prevalence in our communities of people who are caregivers. We have some national numbers, maybe some state estimates. So we wanted to include things there, again, where there's gaps in the data. The next section is on the physical environment. So what you'll see here, this is the same structure for each of those categories, the ones that I mentioned from the County Health Rankings and Roadmap, so physical environment, social economic factors, clinical care, and health behaviors. They all follow the same true-false format. So we're asking people to respond to these statements. All of the statements are positive statements, so they have a positive valence. So it says there is enough housing, air is clean and breathable. And we're asking people if that's true or false for their neighborhood. So neighborhood is really the focus here. So we want people to think locally and to see kind of how it directly affects their immediate surroundings. So this section asks things about exercise opportunities, housing, places where people can get together, roads, pedestrian safety, active transportation, vehicle and transit access. And one of the reasons that we are kind of asking these questions at this level is we've also have a lot of information, and many calls from our partners to focus more on these social determinants of health. So you'll see some of the health behaviors at the end, but really the first three sections are really focused on the neighborhood and the place, because we know how much these different factors really do influence health. The next section is on social and economic factors. So this is asking people about community safety, whether neighbors know one another, questions about employment and income, social support. And we know sometimes people will be kind of thinking about themselves and their family and their immediate family, but they're also thinking hopefully about their larger community. So in their neighborhood, are there employment opportunities that are close by, or are most of the people traveling far to get work? So we want to know these kinds of things and how they might relate to one another and other factors. You'll also see one of the things we looked at as well is those surveys already taking place across northern New Jersey. So there's a couple organizations and groups that had surveys that were going out across all 5 of our counties, or that they were of specific interest of one of our grants. So for example, you'll see a couple things here about community pride and community influence. If you're in Sussex County, you know about our Forward Franklin initiative. They needed to, as part of the grant that is through the North Jersey Health Collaborative, to get a baseline for sense of community in their area. And this survey is able to replace the need to do that. There were a couple other areas too where we were able to say, okay, is there a way to stop doing these other countywide surveys or other broad surveys and use this instead? And we're able to do that in several cases. So that was also a kind of a success to a partnership, was to kind of get rid of some of that duplication of efforts. The next section focuses on clinical care. So this is asking things related to health insurance, local care options, primary care, that the healthcare that people receive is of good quality, dental care, drug and alcohol treatment, emergency care, and mental health care. And then the final section is looking at those health behaviors. So this is the only section that asks people to respond specifically about their own behavior. The other ones, like I mentioned, are at that neighborhood level. We also made the conscious decision, intentional decision, to not do this in the style of kind of a Burfus or those phone surveillance surveys that are asking about specific health issues. So one thing you'll see that's not included in this survey are things like, do you have heart disease? Do you, these kind of health outcomes or disease characteristics or diagnoses. So we have a lot of that data through our secondary data on our website. So one of the things here we're looking at are specifically those behaviors. So those things that we know contribute to people's health, that they do have that kind of control and decision-making power. And it's really, again, this focus on prevention that we have throughout. So these questions relate to alcohol use, drug use, nutrition, sleep, stress, and then some specific questions related to substance use. And I will note in the final version, abuse was changed to use for the trend in kind of usage of that terminology. Everything else is final though. And we'll also ask about kind of medication disposal and some of the other things in the community. The last sections are some overall. So this is where you'll see the well-being question and then a way for folks to help us prioritize. So the well-being question came up because on our website, and I'll show you, oops, nope, that didn't work. On our website, we have these what we call kind of top box indicators that kind of show us how the health of our community is looking in terms of in each of our counties, the age-adjusted years of potential life lost, for example. And we also have within county disparities in life expectancy at birth. So these different things are showing us a little bit about the barometer of kind of overall health, and then how is that health distributed across our communities? Are there areas where people are more healthy than others? And when we were showing these and really working to have these as our kind of broad overall county goals, one of the things that folks commented about was the need for just also, how do folks feel about their life, like in terms of their well-being, their life satisfaction, because you might be healthier or not, but it also matters how you feel about your own kind of life and well-being. And that's one of the things that we've seen in other models. So the purpose of this question here, the Your Well-Being question, is to give us actually a county level kind of barometer for well-being, which we think will really add to our kind of understanding of health. And that's something, again, that we'll be able to track over time. And that's a standardized measure for well-being that's been used in other contexts. And then we also wanted people to tell us from their perspective what topics they think we should work on. So this part of this reasoning, including this, is to give us a sense of all the things they mentioned, they probably feel more strongly about a few things than others, but also to help give the survey the feeling that it's going somewhere, that there's intention, that it's action, that we want to use this information for a reason, that we're not just collecting it to study or to have a study on your neighborhood. We're doing this because we want to be able to improve health, and we need this information to help us do that more effectively. So here we ask people to think back over the previous sections. So everything that you saw in bold in the previous sections is included in this list. So of all these different things, which do they think should be the main focus when trying to improve health? And we asked them to circle up to 3. And then the very last thing as part of the main survey, we ask people if they want to write in to tell us a little bit more about why these issues should be our focus, and also to get at some potential disparities, to answer are there issues that are a bigger problem for some groups than others, and what that looks like. So for example, someone could have selected in the first, in this section up here, one of their main things they think we should work on is health insurance. So they select that. They go to the next section and say, why do we think that should be our focus? So they say, okay, you know, maybe more people have health insurance, but, you know, in my neighborhood, and a lot of people are talking about how high their deductibles are. They're still not able to afford whatever it is, medication, specialized treatment. So I still think that's a major issue we need to work on, okay? And then the next section, they might say, yes, this is a bigger issue for, you know, single parents, or for recent immigrants, or for people whose English isn't their first language. So to get us a sense of where they might see those disparities. The final question is asked, is there anything else you want to tell us about your community, good or bad? This is in case we missed anything that they really wanted to share, because we're really encouraging people that this is your opportunity to show your voice and share what you really think should be the priorities for our communities. At the end, which we really highlight to make clear that it's optional, folks can join and give us information in order to make a difference. So again, that focus on action. And if folks want to give their first name, email address, and phone number, they can select what type of follow-up they would like. So they can see a summary of what other people had to say. They can be entered into a drawing to win a $100 grand prize. And they can also offer, if they want to join us, join the North Jersey Health Collaborative to make a difference on these topics. And a lot of our work groups have been really looking for more direct community engagement and, you know, volunteers from the community to help inform them and do the work. So we're hoping this might also be a mechanism to recruit folks into the collaborative and to build some of that community support. I will note when I say community support too, we're also talking about all of you. So when you're administering the survey, it's really important to remember that you're also a member of your community, and that are the folks that you work with. So your staff, your coworkers, whoever are also members of the community. So we also encourage you to take the survey with your organizational link and to encourage others that you work with. So not just for the folks that you might see as your clients or the people that you see as the broader community. We're all part of this community, so our voices are also important too. So, and then at the end here, we have a way to connect folks to resources. So we're using our partner NJ211 as the main kind of push for resources. If your organization has not checked lately to make sure that your information is up to date in 211, I would also really encourage you to do that. This is a really great opportunity to do that because we have on our website all of those 211 resources, but we also know that folks can always pick up the phone and dial 211, and we felt like that would be the most kind of immediate response. For example, if someone was taking the survey and felt that they should they should have something to do, like they should have something that can be followed up with. So that is the survey itself. A couple other just general things before I go over kind of the frequently asked questions and guidelines for administration. This survey is for 18 and over only. We're talking with the data committee and working to find some other better mechanism for working with younger people in terms of their perceptions of the community. But with this survey, because it does ask about some health behaviors and specific things like that, and because of the issues we run into with, you know, informed consent and parental consent, we didn't think that this was the best way of getting that information, so it is 18 and up. It is, although our primary push is in the 5 counties of the North Jersey Health Collaborative, anybody really technically in New Jersey can take it. They would still have that option to fill in their information. We'll be able to separate in the back end kind of where people are responding from, but we also know that some of our organizational partners have a wider spread than just those 5 counties. So they might be in, you know, neighboring communities in like Somerset, Bergen, for example. So if your organization is has that footprint, you'll still be able to get your data, and we'll talk a little bit about what those benefits are for participation for organizations. I also saw a question come in regarding the personal information. So the question from Katie was, is the optional personal information separated from their responses? In the online version, it is on a separate page. In the paper version, it is all together. And then in the way we do the analysis, as soon as their responses are submitted, that information is kept separately. So we'll talk a little bit more about confidentiality and anonymity here shortly, but it's not physically separated in the paper version. And so we've had some specific considerations for how that data will be handled. So for example, we're asking in our guidelines for those administering the survey on the paper version to keep that confidential, and all the data entry will be done by data committee members. So when you, if you collect paper surveys for your organization, you can just email data@njhealthmatters.org, and that information will be able to be picked up. Someone will come and actually get it for you and enter that data, so that we're able to maintain kind of the chain of ownership of that data and to make sure that the responses remain confidential and securely kept away. So we'll talk a little bit more about that in the next section. Thank you. I also saw another question coming in too, and too at the end. I will also unmute everyone at the end, I promise, for like free discussion. But I want to respond to the questions as I see them too. There was another question from Kevin asking if we'll be able to separate Morristown and Morris Township because they have the same zip code. So yes, so the way the survey works, and if we have time, I might be able to show you the online version, is municipality and zip code are both factors. So as long as the state of New Jersey considers it to be a municipality, like a formal municipality, then there will be a distinction between the two. And I'll double check and pull it up and show you what that looks like. But if it's a smaller area, so there's some places that are called like place names or things like that that might not be included. We're hoping that that's where people might write that in. But if there's a separate municipal name, even with the same zip code, then there would be two separate options for that. All right, so what I'm going to do now is I'm going to go back and show you a little bit, go through the guidelines for administering the survey. So hold on, let me switch. Okay. So I'm going to go through these guidelines. Hopefully they'll answer some of your questions along the way, but again, please keep chatting or answer questions at the end during the FAQ, or share your questions at the end. So these are some of the guidelines that we have. If you agree to participate, and some of you may have already signed up, you will be given kind of a welcome packet that goes over all of these guidelines in greater detail. I'm going to talk through them, but they're also kind of written out. And this is really something that we hope that our partners will really look at, read through. And then by agreeing to distribute the survey, you're saying that you will adhere by these guidelines. So if you have questions about the guidelines, please be sure to ask. So the first one is that participation in the survey is voluntary, which this means is that we can't coerce anybody to participate, and we also can't force or coerce or push too hard for them to complete the survey. So for example, if someone turns in a survey, a written form, for example, that's only halfway filled out, we're not able to say, oh, wait, hold on, you missed it. You got to fill out the rest of the survey, please. Because that's, their voluntary participation means that they don't have to do it, but it also means they don't have to answer questions that they don't want to answer. And so we do say that in the beginning, that if you don't feel comfortable answering something, skip it. And if your response is, I don't know, just skip it. So that's okay. So the participation is voluntary. I want to make sure it stays that way. I know this is especially for when you're working with folks you really know. I've seen this a lot, and where someone's like, it's their, someone they work with frequently that took the survey, and they say, oh, hey, John, like, hey, you didn't fill this out, come back. Because they think, yo, I know this person, it's not a big deal. But we really want to make sure that we maintain that voluntary participation and that we can say that for sure. The responses must be kept confidential. So we know that if people add their name to the written form, for example, it's not anonymous, but it is always confidential. So what that means is if they do put their name on it, obviously their name and their information are there on that form together, but that form will always be kept secure, and their responses will never be shared with their name or identifying information. So as soon as that data is input, it's kept separately. And in the analysis, we're never looking at that piece of it. We're never looking at their name or their email address or their phone number as part. Those aren't fields of our data analysis. So that's kept separately. The only purpose for that is to be used for what they said they wanted the follow-up for. So if you remember on the survey, they could select that they want to hear about other people's responses from their area, obviously in aggregate, or they want to be entered into the drawing, or they want to be part of the collaborative. Those are the only three things, whatever they select, one or two or three, that their name and email will be used for. The only thing. So you can assure people that it's only for that. That also means for our organizations that you're not able to use that information for other purposes. So, you know, say you have 100 people fill out the survey for you, and you have, wow, here's 100 new email addresses that we could add to our distribution list. Nope, can't do that. So that information is only for what they expressly gave their consent for it to be used for. We encourage folks, if you're doing the paper version, to make sure that as soon as surveys are filled out, that they're put away securely. The best place is just a locked filing cabinet or drawer until they're ready to be picked up by the data committee. So that also means don't leave a stack on the desk and let people just come add theirs to the pile, you know, unless someone's standing there monitoring it. Make sure that the folks administering the survey aren't flipping through the pages and reading what people had to say. It's tempting, it's interesting, I know, I love data too, but we need to make sure that nobody is really looking through and reading the information, especially that no one's looking through it and reading about it and then talking about it. So for example, if someone was, you know, at the front desk of an organization, they had 10 of those surveys, they have a little downtime flipping through it and they're like, oh, it's interesting that, you know, Juanita said this, but, you know, Joe said that. So, you know, just those things that to keep that confidentiality of the data. Verbal one-on-one or group facilitation is an option. So what that means is when I was showing you the survey, how it kind of reads like a script, is that people can go through it verbally with somebody who needs assistance. So you can read through it verbatim and ask for people's responses. Either they can mark themselves, or if they do need some assistance, you can help them as long as you're entering it specifically what they said. The group facilitation would mean you reading it verbally and having a group of people fill it out on their own, potentially with someone walking around to help them to make sure they're at the right place on the survey and they kind of know where we are in the flow. We know for some of our partners, that's the best way to work with their clients or community members. Paper surveys, like I mentioned, will be collected and entered by the data committee. That's what we hope to be a benefit to our partners. Really, the overall goal here is to make this as easy as possible for our partners to administer. So we want to make it simple for you. So that means no data entry, and that the analysis is done. You don't have to do the analysis either. I'll share in a minute some of those benefits, but all of the organizations who sign up get their data back. So you get the data that you collected. That's part of the reason we have the separate personalized paper versions and the personalized links, is because we'll be able to see, you know, if they took it from your link or from your organization and give you back your data. So if you want to look at it and analyze it, totally fine, that's your data. If you want an analysis of it to be done, so we can give summaries of the kind of the main points and things like that for each of our organizations, that can be done too. So that's another benefit to participation. And we know that it's a big barrier to have to enter that data, so we're happy to provide that and really grateful for our partners, especially William Patterson, for being able to do that. Please identify yourself when asking people to participate. We want to make sure they know who you are, why you're asking this information, you know, what your organization is and does, and the connection to the collaborative. We ask people to remain neutral and unbiased, so try not to persuade people or change their opinion in any way, or even just when you're handing out the survey to say, oh, here's this survey, they want to see what, like, you know, all the bad things that are going on in the community. You know, just keeping a neutral language when you talk about the survey itself and the administration of it. And then we ask finally that folks not fill out any part of the survey on behalf of someone else. The only exception is the one I already mentioned. So that's if someone is not able to write their own responses and you're administering it one-on-one, you can write on their form as long as you write exactly what they say without any edits or additions or changes to it. But otherwise, to not fill out the survey on behalf of someone else. So this is another one we know that can be a little tempting when, for example, say that someone turned in their survey, and it says, because you know who they are, you know where they live, and you know that they, for example, do identify as Hispanic or Latino, but they didn't fill it out. Don't fill it out for them, even though if you know. So even if you know that person and know their response. So that's another thing. We just make sure that folks know that even if they left it blank, even if you have that information, please don't add it to their form, because really this helps maintain, again, that voluntary participation where they can skip stuff if they don't feel comfortable adding it. So some of the benefits, I've mentioned a couple of these as we've gone through, but these are what we hope to be the benefits for our partner organizations for participation. So the first is access to a customized survey link and paper forms. So when you sign up, either using that link that I chatted out just now, or that you may have seen through Catherine's email that went out to everybody, or if you fill out a paper form at one of our county committee meetings. So we'll be doing this presentation at our upcoming meetings. We have 2 left, I think, in Warren and Passaic. We've done this presentation in Morris and Union and Sussex. So if you filled it out in person, within a couple business days, you should get a link, the welcome package, and the survey, a paper version or the PDF version of the survey. And you'll receive that in the 3 languages that we currently have the survey in. So those 3 languages are English, Spanish, and Arabic. We're looking into translating it potentially to other languages. The form will give you the option when you sign up as an organization. We'll give you the option of saying if you need it to be translated into another language. We might not be able to accommodate all requests, but we're going to do our best to do that, just keeping in mind that that's professionally done and is a cost. Another benefit for participation is that on-call support and training for members of the data committee. This counts as one training, the in-person trainings that we've done in our county meetings, of course, but we also can answer questions. But anytime you want to email data at njhealthmatters.org, you can do that, and you can also request in-person training for your organization if that's something that would be helpful if you have many people who are going to be administering the survey. The data entry services, again, like I mentioned, for those paper surveys, you won't have to do that. Hopefully that's a big benefit, because we know that can be a big barrier for folks. You'll have access to the data collected by your organization, analyzed and presented in a custom report, or like I mentioned, if you want the raw data, if you have folks at your organization who like to do that, we can share that as well. This data is owned by other partners that collect it and the collaborative as a whole. So we're happy to share and help analyze to meet the needs of your organization. Another benefit that we hope that kind of longer term, once we finish data collection, is this access to local and geography-based data. So a caveat there is that we need enough data or need enough surveys completed in that area for us to be able to kind of analyze or separate out that data. So for example, if your organization is really interested in the responses from a particular neighborhood or zip code, we really need your help to actually get the surveys completed from folks that live in that area. Because, for example, if there's only 2 or 3 people for that zip code, we can't disclose that data at that level. Okay, so that's at that point, it's too small of a number, it's too identifiable. So what we would have to do is roll it up with some other zip codes or regions. And so we might have to do that in certain areas. We'd love to be able to separate it by all the zip codes. I don't think we'll probably get there, just because unless we get a lot of surveys. And we could if you guys help us out in that way. But if you have a certain area that you're really interested in having that breakout, we need to make sure we have a sufficient number of respondents from that area. And then another benefit, to hopefully make it a little easier for administration, is that in the welcome package, you'll have a partner recruitment template, participant recruitment template. So basically, you'll have a sample email address or email language, a bunch of Facebook posts, and a bunch of Twitter messages, tweets that you can just copy, paste, send out with your own link. So we want to make this as easy as possible, and hopefully that'll help to spread it out through your own networks that you have, but also to put on social media, because we know a lot of folks have pretty active social media presence. And the last thing is I'm just going to go through some frequently asked questions that you might get, and then I'll open it up to your questions, additional questions that you might have, and we'll unmute everybody at that time. These are the questions that you might receive from people taking the survey, but it also gives us a little bit more information about the survey for our own purposes. So what's the purpose of the survey? So we really want to encourage folks to share that the reason we're doing this is because we are collecting information as a collaborative to figure out what we should work on to improve health, and that this is an opportunity for them to share their voice, to help us hear from people who live and work in the communities, and to really find out what we should really focus on. In terms of risks associated with participation, there's really no known risks. The only thing is, it might make someone think of a resource that they're lacking in their community. So for example, if it's talking about that the air is clean and breathable, and then they're like, oh gosh, no, it's not, and my asthma has been acting up, it might make them think of something that they might need additional assistance on. So we're hoping that by providing that NJ211 resource, that if there is anything that comes up, that they can get the support that they need. Benefits for participation include a chance to tell us what you think, to have a role in improving health in your community, and then of course that those gift cards for $100 or the signed Jets football. Are the answers anonymous? We talked a little bit about this. So responses are anonymous unless they add their contact information, but even if they add their contact information, their responses are confidential. So they're never shared with your name. And that's kind of the message we want to really be clear with people, and that we're going to protect their identity, that their identity will be protected at all times. They don't have to put their last name on that form either. We just need a first name, so we make sure we're getting in touch with the right person if they win $100, basically, or if they say they want the results or to join us. The results will be used by the collaborative to help do our needs assessment process. The results of the survey will be made available to the public on our website in aggregate. So they're going to also be created into these indicators so that anybody can go look and see how other people are responding to the survey as well. But again, and confidentially, without names. Who should take the survey? Anyone, again, 18 and older, who lives in northern New Jersey is eligible to participate. But as I mentioned, that footprint can be a little broader if you need to. The drop-down list on the online form, for example, include all New Jersey municipalities, just so no one's just excluded there on the form. But really, we're focusing primarily on those areas that the collaborative covers. So that's Morris, Sussex, Passaic, Union, and Warren counties. And that this will help us make good decisions about how to improve health and wellness. Who will see the responses? So only the person, if you're doing a paper version, only the person collecting it has the potential to see it, but they're not going to flip through it. Again, that's part of those guidelines we want to adhere to. And then a select few researchers at my center, Atlantic Center for Population Health Sciences, will see the full survey, but as soon as the data is entered, the responses are saved separately from their name. So their individual responses will be anonymous. And that we're going to keep that information secure and confidential. The online service that we're using is secure. That information is locked, so anyone can go get it. And then, can you take the survey more than once? No, we're asking people to take it only once per person. A little note here, you might have seen on the sign-up form that organizations can say whether or not they're going to be administering this on a public computer or device. So the default for the survey link is where it can't actually be taken by the same person if they're using the same device. So the IP address is the thing that's captured there, not the name or anything like that. But so for example, if I take it from my phone, I can't take it again from my phone. If I try to take it again from my phone, it'll say, hey, you've already taken this survey. Please contact blah, blah, blah for questions. But there are some instances, for example, if someone wanted to do this at a public library where they might want it to be taken, they have to, that setting needs to be turned off basically, to where it can be taken more than once from the same computer or device. So if you put it in a public library as the home page, which is a great way to do it, the first person to take it, if the setting was on, would be able to take it, but the second person who sat down would be told, you've already taken the survey, even if they weren't the one taking it. So we can turn that setting off for those public administration. And in most cases, people are not clamoring to re-participate in surveys. Usually it's, you gotta get them once and they're good. So there is the possibility if someone were to take it from their phone and then their computer and then their brother's computer. But again, we don't think there's gonna be that much of an issue with that and haven't seen that issue in the past with other surveys that we've administered. Prizes, people know if they won, we'll email them or use the phone number, whichever or both that they provide. And anyone, yourself included, but also the participants, can always contact data@njhealthmatters.org. Oh, that's a typo, my bad. So it's just njhealthmatters.org, no extra period. I'll take that out. I keep saying that, I keep forgetting. But you'll see that in the welcome packets, correct? So make sure you let folks know that they're always able to email with any questions. Additional support, you guys are here on this January 22nd, 11 a.m. webinar. Thank you so much. There is going to be another one on February 9th at 2 p.m. if there's additional folks from your organization who would like to receive training, or other organizations who you think might be a good candidate to sign up. So that's another way you can help us recruit. So you can sign up as your own organization and administer the survey, making sure that you also take it and that you administer it to your fellow coworkers and others. But you can also, if there's other organizations or coalitions or groups that you know of that would be good candidates for this and that would benefit from having this for their own needs assessment purposes, they don't have to be an existing partner for the collaborative to administer it. They just have to be willing to participate in this process and adhere by these guidelines. So feel free also to share. I'm recording, as I mentioned, this webinar, so I'm going to be posting it on the website where I first showed you where to find the preview. And then in-person training, again, is available upon request. So you can always reach out and let us know if you have any needs for us to come out in person to your organization or to facilitate a regional one or however it's needed. The survey will be open all the way through April, so there's some time for that training if needed. But for those of you who already have your links and have now officially been trained, congratulations, you have your certificate. You can go ahead and start, so there's no need to wait for additional training unless you feel that is necessary. So that's kind of the overview of everything. Right now, I'm going to unmute folks. Hopefully we don't have any echoes or anything crazy. Please be advised that you will be unmuted. Yeah, just ask any questions. We have some more time here at the end of the call for that. And thank you so much for listening to me. I know it's hard just to talk this long, and I apologize that I'm blabbing on, but hopefully you have the information you need. And everyone is now officially unmuted. Any questions? So a question popped up, will the survey be available in other languages? Yes, the survey right now is available in English, Spanish, and Arabic. If you noted on your form that you need it and when you sign up in a different language, we're going to do our best to accommodate those requests. There is a cost associated with it. Apparently, unfortunately, we're not flush with cash as a collaborative, but especially if we can have some support from the organization to translate, we can translate into other languages. Right now, we're looking at the possibility of translating it into like French Creole was one of the requests. And I think we might have had one other request for Portuguese. So we're looking into that. But if you do need additional languages, make sure to note it on the form when you sign up or reach out to data@njhealthmatters.org. Other questions? Anything else? I didn't see any pop up in the chat, but feel free to speak up if you do. As we get more FAQs, we can add them to the list. I'm going to put the FAQs on the website as well at some point soon. And I did want to add too, in the past, we've had questions about kind of the analysis of the survey, why we ask certain questions a certain way. So if you do have those questions, feel free to email them to me. But we want to look at this survey geographically. We want to look at it across so a countywide, zip codes, compare and kind of look at those things, how they change across areas, but also comparing within certain things. So for example, if we find out that people who say their community is, they don't have a safe community, if that's strongly correlated with lighting and walkability, we have a little bit of a hint of how we might best intervene in certain areas. So we're going to be looking for that as well. Okay, so there's another one. Will there be more surveys in the future? Because I think is good feedback from our families. Yeah, so we're hoping to administer this survey at a regular interval. We're not sure yet if we want to do it yearly, every 2 years, every 3 years to coincide with our needs assessment. But we do want to be able to track this over time and have this information from folks. So that's a big part of it, as well as making this part of our regular practice and hopefully something that people start to expect and rely on as our organizations and as our families in the community. Another question, what's the time period for administration? The time period for administration is, it's going to be open until April. So we're hoping to have this information analyzed for a June convening around that's being developed by our process implementation committee to start prioritizing some of this information. If you want shorter deadlines, sometimes it's helpful to give folks, a couple weeks once you start and end. But when you start and stop the administration for your specific link is really up to you. But the whole, as a collaborative, will be open through the end of April. Another question, if we're sending out the link via email, is there a subject line that you found helps most people open and take a survey? So we had a suggested survey, a suggested subject line, I think, in the welcome packet. We don't have anything specific, but one of the things that we had encouraged folks to do is say, like, this is your chance, share your voice, or something that's more like a little bit like appealing. If you want to chat more about specific ideas, we don't have a standard one. So it's really up to organizations if you have something that works good for you. But that's something we could definitely brainstorm with you if you aren't getting those responses you need. Any other questions? And feel free to everyone's unmuted now if anyone wants to speak as well. We should be able to hear you. Okay. Well, seeing no other questions, I'm going to stay on the line until the call is officially over, till the hour is finished up. But if you're all finished up, thank you so much for joining. Let us know, reach out, any questions you have. Feel free right now or tomorrow or as soon as you can to use that link I sent out at the beginning of the chat to sign up. And if you have anything in the meantime, you can always talk to us via data@healthmatters.org. So thanks and have an awesome week.